I'm going to go ahead and get started. My name is Tasha Poinsett with the Healing Advocacy Fund, and I want to thank you all for joining us for this webinar focused on referrals into the state-regulated psilocybin therapy programs. And we actually just had a related webinar yesterday on dual licensure in the state-regulated programs. So some of this is going to be building off of that for anyone who was on yesterday, but also a pretty distinctly different focus. So a little bit about the Healing Advocacy Fund for those who are new here. We are a 501c3 nonprofit whose mission is to expand and protect safe, affordable, state-regulated access to psychedelic healing for all who need it. And we are currently active in the 3 states in the US that have passed some form of ballot initiative or legislation creating state legal programs for people to access psychedelic care from licensed providers. And so really we are working with state government, doing stakeholder engagement and advocacy work to inform responsible implementation of these state legal psilocybin therapy programs, identify issues and find resolutions to them, and then also support the provider communities to understand what these programs are and to get their practices up and running with a focus on safety and ethical practice. So really high level when we're talking about the state-regulated psilocybin therapy programs in Oregon and Colorado, there's a few components that are required in these state programs, and I just want to lay those out so that everybody's on the same page about what we're talking about here. So these are really programs that are geared towards people that are seeking access to psilocybin for mental health issues that they've been dealing with. It could also be, personal exploration, other reasons. This is not a diagnosis and prescription model, but there are several steps required for access through these state legal programs. So the first required step is some form of safety assessment with somebody who is trained and licensed as a facilitator to identify if a person seeking access has any kind of contraindications or risk factors that could put them at higher risk from consuming psilocybin. And then also to match them to a facilitator who has appropriate training to support them with whatever their goals are for participating in that session. The second step is a preparation session where this licensed facilitator meets with the client to explain the types of things that might come up during a psilocybin experience, discuss their goals or intentions for the session, and also develop a safety plan for how to move forward. The third and fourth steps could be kind of considered one step, but we're separating them out because we think, especially as the newest state to come online, New Mexico, adds their program, there might be a bit of a distinction between administration and facilitation. But essentially, the day of somebody's psilocybin experience, they're going to go and meet with this licensed facilitator. They're going to be administered psilocybin, and they're going to be receiving support throughout their psychedelic experience to support their safety and also just emotional well-being and kind of stability during that experience. And that person's going to remain with them throughout the duration of the experience. And then finally, the last step is integration. This is where the client meets with the trained facilitator to discuss what came up in the session, apply insights and learning, and really have a plan for how they're going to move forward and integrate that experience into their life going forward. So that's the high level of what we're talking about in these programs. There's a few differences across the 3 states that have created legal programs for psilocybin therapy. So in Oregon, Colorado, and New Mexico, we are talking about natural psilocybin, not synthetic. So this is cultivated psilocybin-containing mushrooms. In both Oregon and Colorado, providers need to have at least a high school degree, and then they need to complete state-approved training and apply for licensure. In Colorado, there are 2 license types for these facilitators. There's a clinical facilitator license type, which is somebody who's completed the state minimum training to be a psilocybin facilitator, and then also separately holds an active license in Colorado to practice either medicine or provide mental health care, so therapists and doctors primarily. And then there's a facilitator license, which is somebody who has completed that state required training, but does not separately hold a license to practice medicine or psychotherapy. In terms of eligible participants, In Oregon and Colorado, anyone who's 21 and up can seek access through these programs. And then there's going to be a required screening process to identify those risk factors that I mentioned earlier and direct them to appropriate levels of care. And then in terms of where this takes place, at Oregon, there are licensed service centers where all psilocybin therapy takes place. In Colorado, there are licensed healing centers where the majority of sessions are going to take place. And then there's also allowances for at-home sessions for eligible clients, which is, people living with a disability, receiving palliative care or on hospice that can access this either at their home or at a licensed healthcare facility. So I focused mostly on Oregon and Colorado. New Mexico has not yet launched their psilocybin therapy program. They have passed legislation and they are at the kind of early stages of a 2-year rulemaking process to decide on some of the specifics of how this care is going to be administered. But there's a few differences in New Mexico, including a requirement for administration by licensed healthcare providers, as well as qualifying conditions for access. So something to keep an eye on as New Mexico moves further along in their process. So when we talk about the state access models for psilocybin, really high level, I think it's important to emphasize that there are components of this that are structured to support client safety. We know that people have been seeking out some form of psilocybin therapy or care within what we call the underground for many years, and have seen substantial benefits from it. But there's also some challenges around that, particularly with lack of kind of transparency or awareness of what is the level of training of facilitators. And so in these state programs, there's very clear facilitator training requirements. There's a required screening, as I touched on. There are ethical codes for facilitators and clear standards of conduct. And then there's a complaints process in the event that something does happen in a session. And there's also reporting requirements specifically for adverse events and helping us better understand, how people are benefiting, but also, what is the potential harm that can come from this. On the access side, we're doing a lot to try to support this kind of therapy to be more broadly accessible. So some components in Oregon and Colorado, again, no requirement for a qualifying condition or prescription, which is really reflective of the broad range of conditions and circumstances in which somebody might potentially benefit from psilocybin that aren't limited to specific conditions. Again, we're talking about natural psilocybin, so this is not, a patented compound from a pharmaceutical company. It's something that is grown by state licensed cultivators and manufacturers. And then a couple other components, group sessions are allowed for psilocybin therapy in the state programs, and remote preparation and integration are allowed. So the only piece of the process that needs to happen in person is the facilitation of the psychedelic experience itself. In terms of those screening requirements, so that does vary across Oregon and Colorado. In Oregon, there are 3 clear exclusion criteria, and that's if somebody has taken lithium in the past 30 days, has thoughts of causing harm or wanting to cause self-harm to self or others, or has a diagnosis of active psychosis. So those are the 3 cases in which somebody would not be able to move forward with psilocybin therapy. In Colorado, we have a different approach. So Colorado is not focused on exclusion criteria, but rather identifying potential risk factors and then requiring consultation and risk review where a risk factor is identified. And then knowing what those risk factors are, there's an informed consent process for both the facilitator and the client to decide whether or not they want to move forward with psilocybin therapy. If a risk factor is identified during this screening process that falls outside of the scope of practice of the facilitator, there is a requirement that that client either receive a referral, clearance, or complete consultation and risk review with somebody who's a licensed healthcare provider for whom that risk factor falls within scope of practice. And I think that's important to emphasize because what that means in practice is there may be more questions arising where clients are trying to get a better understanding from their healthcare providers about whether or not they can move forward with this. A couple key pieces when it comes to conversations around referrals into the state programs. So there are protections now in both Colorado and Oregon law for licensed healthcare providers to discuss psilocybin therapy with patients and clients. It's phrased a little differently in each of the two states, which has implications for exactly what is allowed. So in Colorado, a professional license holder is not subject to professional discipline or loss of their license for providing advice or services arising out of or related to natural medicine, on the basis that this is prohibited under federal law. And so I think the word advice is key, because that probably does give you a little bit more room under state law to be actually making recommendations around this. Now, there's probably some caveats to that to consider, but that's the language that is in law in Colorado. And then Oregon recently changed their laws to allow greater ability or protection for healthcare providers to discuss psilocybin services with patients and clients. So healthcare providers there will not be penalized for discussing with a client or patient as a treatment option psilocybin services. So this falls short maybe of recommending, but it does make it very clear that you can be answering questions, providing information about this as an option for people. And I just want to pause here and say we're going to have, of course, a lot more conversation around referrals with the three panelists that we have today. So what I'm doing now is just sort of a high level to get everyone on the same page about the programs themselves. But that being said, we had this webinar yesterday with three law firms that were talking about the question of dual licensure, or combining a healthcare license with a facilitator license. And they raised a few considerations for people for healthcare professionals thinking about referring into the psilocybin therapy programs that I thought were worth highlighting here. And so if you're thinking about talking about psilocybin therapy with your patients or clients, a couple don'ts. We're really not at a point where it's advisable to be providing clearance or clearly giving somebody the green light. Yes, psilocybin therapy is safe for you. And that's a number of reasons. I think, it's important to highlight that these programs are state legal. They are still federally illegal. And so there are some risks that come with that for healthcare providers, even despite the protections that I've just outlined in state law. And then, they're not FDA approved yet. And so we are still learning a lot about who the psilocybin therapy is safe for, what are the risk factors. We're just not at a point quite of giving that kind of green light clearance. And then similarly, avoiding promising any kind of a specific outcome. The more you learn about psilocybin therapy, the clearer it becomes that this process is nonlinear, that the experience is very individualized and outcomes vary for different people. And so there is no one clear outcome that anyone can promise. Best practices to avoid that. However, what you can say, the language that you can use with patients, or that at least was advised by these three law firms yesterday on the webinar, nothing clearly disqualifies you. So if you've completed a level of training to understand what are the risk factors associated with psilocybin therapy, and that isn't arising for a patient or client, that might be language that you could use to help them help inform their decision if they're thinking about psilocybin therapy. Of course, providing information about what we do know from the clinical research, which indications have we seen that might particularly benefit from working with psilocybin. And then it's very important to be very clear with patients and clients that psilocybin therapy is not FDA approved. And then finally, the best practice that was recommended if you are referring into the program is it's probably better to refer to multiple facilitators or healing centers, or even a directory or list of centers, rather than just focusing on one practitioner. And that's really just a consideration to limit your liability within the referral process. So in terms of where we are in these two programs, so Oregon launched its psilocybin therapy program about 2 years ago. There's over 300 licensed facilitators, 25 licensed healing centers, and we believe that at least 14,000 people have accessed care through that program. So far, from what we know, the safety profile of the program seems really strong. And the main way that we're able to track that is the number of calls to emergency services that have been recorded through the duration of this 2-year period. So across those 14,000 people, the last time we pulled those numbers, there had been fewer than 20 calls to emergency services that were required. Colorado is, of course, much earlier into our program. We're about 4 months in. We have 22 licensed healing centers. And we do already have almost 500 licensed facilitators, including those people who hold training licenses. Facilitators in training are able to facilitate, they're able to practice. They just need to do so while they're completing required consultation hours with somebody who's a more experienced facilitator. And then we do not yet have numbers about the number of care sessions completed in Colorado. So I will probably circle back to this slide at the end of the session today, but a few resources for folks who are interested in providing information to patients and clients about care through this program. On our website, we make available a service center directory for Oregon, a healing center directory for Colorado. We've also created a client guide for each of these two states, which really walks through in detail many of the considerations around psilocybin therapy. So how the programs are structured, what are the potential risks, why might somebody consider seeking access for psilocybin therapy? And we were really careful in creating that to try to be very, very realistic about what psilocybin therapy is and what it is not. And so things like not promising a specific outcome on the client side, not going into this with a specific expectation are components that we tried to include there. So I definitely recommend taking a look at that. And that's available as a resource that you can also share with clients as well. And then finally, it's worth checking out the two state websites, or three really, in Oregon and Colorado, which are the agency websites, which provide a whole host of resources. And then finally, for people who want to continue their educational journey around psilocybin therapy, we've created a psilocybin therapy continuing education directory, which is a list of different CE and CME approved courses focused on this topic. So this is all available on our website, healingadvocacyfund.org, and I will also share out this presentation after the session today. And then finally, just one course I think to really emphasize here is a course that Healing Advocacy Fund created in partnership with the Psychedelic Medicine Association, focused on managing medical risk in patients seeking psilocybin therapy. This is really geared towards MDs, PAs, and NPs, worth 2 CME credits, and can help walk you through in a lot more detail some of those risks to consider and how they can be managed. So with that, I'm going to stop the screen share, and we are going to move into the discussion portion of this session with our 3 panelists, Inna Zelikman, Joshua White, and Yuriy Blokhin. So to kick us off, I just want to ask each of the panelists to give a quick introduction so folks can understand who you are and what perspective you bring to conversation around referrals into psilocybin therapy programs. So starting with Inna.
Yes, hello, good morning. I'm Inna Zelikman, and I am a psychiatric mental health nurse practitioner. And I am licensed both in the state of California, and I've become licensed in the state of Oregon as well. I've been in the field of mental health, addiction, and chronic pain for over 20 years. I've also done ketamine-assisted therapy with the clients and really know how to be firsthand sitting with patients in non-ordinary state of consciousness. What originally brought me to the work with closer with psilocybin services in California, the practice Recovery Without Walls, we've created a very specific model, the model that includes a lot of collaboration where the right hand and the left hand are talking to each other and really providing the most adequate and effective outcomes. So I decided to by being inspired through this model, I decided to bring the same thing instead of creating further fragmented care between the psilocybin centers and mental health care practitioners. I felt like there's a stronger need for collaborating. In the last year or so, I've been doing consultations for psilocybin services and working with the patients. And I just wanted to share just a bit of what Tasha said. When we do the consultations, the end of consultation is not to tell the patient to go through psilocybin service or not, but to really provide informed consent and provide adequate amount of information so the patient and psilocybin service can make a decision as to proceed with psilocybin session at that time. So.
Thank you, Inna. Joshua, would you share a bit about yourself?
Sure. My name is Joshua White, and I'm the founder and executive director of a nonprofit called Fireside Project. And I'm here today to share with you how Fireside Project's services can help support all of you and the implementation of this law. So, Fireside Project has two services. One is a free support line for people who are in the midst of psychedelic experiences, but also we offer free integration. We're open 12 hours a day, 7 days a week, and the integration service that we offer on the support line can be a fantastic way of really offering your clients nearly round the clock support for when integration issues arise. In addition, we have a coaching program, which is a paid service where we provide long-term support to people who are preparing for journeys and also integrating. We've partnered with Homecoming and Yuriy, who you'll hear from in a moment, to really offer seamless integration with the service centers. And I'm one of our coaches as well. Sometimes we meet with clients weekly for weeks or months as they're preparing and integrating. So I think this is a service that can supplement some of those offered by clinics.
Thank you, Joshua. And Yuri, would you share a bit about yourself and your work?
Thank you. Yeah, hi everybody. My name is Yuriy Blokhin. I'm the founder and CEO of Homecoming. For the last 5 years, we've been creating an electronic health record system, an EHR, specifically designed for the needs of psychedelic care providers, service centers, clinics, retreats, churches across the spectrum. And something that we as a tool really believe in is the intrinsically collaborative nature of psychedelic care, whether it means facilitating referrals from primary care providers like Inna into psychedelic care, or creating the collaborative care and referral kind of tooling for a service center to collaborate with parties like Josh's team and integration services. So like today, I'm excited to show some of that functionality within Homecoming and how we do that with Fireside and others. And prior to launching Homecoming in 2021, I was also on the founding team at the Heroic Hearts Project, which is one of the country's largest nonprofits helping veterans with PTSD access psychedelics. And really, Homecoming was a kind of labor of love that came out of that nonprofit work with the veteran community. And prior to that, I've been building a lot of mental health care technology projects and organizations as well. Thank you.
Thank you all for being here. So jumping into the discussion portion of the call, I want to start out with a question for Inna, which is high level. Why would somebody refer a patient for psilocybin therapy?
Yes, that sounds great. Thank you. I think this is one of the most important questions to start is why would you want to refer a patient to psilocybin therapy, or why do patients actually seek them out? I think the most common answers that I hear oftentimes is that the patients have been engaged in a conventional treatment. They have maybe failed a multiple pharmaceutical medications, antidepressants, antipsychotic medications, mood stabilizers. Another reason I hear a lot, patients have been in therapy maybe for multiple months or years. They might even say something like, I really have gotten to understand my attachment issues, my trauma. I really can see my patterns clearly, but I just cannot connect to this emotionally and I can't seem to make changes. One of the other reasons is that patients sometimes may be feeling blocked and they need to access the material. Or maybe there's a trauma that they can't process without getting activated and they need a safe way to process the trauma. A couple other factors. A patient may be going through existential crisis. That means maybe they're facing terminal illness. Maybe this is a chronic illness, something that they've adjusted their lives. They're going through transition and it brings up a lot of fear and a lot of anxiety. This is where psilocybin can really bring some compassion, maybe can help them to make sense of meaning. It can help them to really shift their perspective. Another very common reason that patients are seeking out psilocybin therapy, patients who have history of addictions, they just cannot break away from addictions, or they can't break away from the compulsive behaviors. And what a great way for psilocybin to really reveal what's sort of underneath that, create some motivation, and maybe can help them to tap into their core values.
Thank you, Inna. And then I think you started to touch on this, but are there mental health conditions that appear to particularly benefit from psilocybin therapy that you would say kind of rise to the top for you?
Yes, certainly. There is right now a plethora of research that's been coming out in the last few years about treating certain mental health conditions with psilocybin-assisted therapy. I think the strongest evidence at this point is for major depression. I mean, there's studies coming out from Johns Hopkins, Imperial College of London. A lot of the studies are showing a significant reduction in depressive symptoms that actually last into a period of 6 months or even a year, which is incredible. And this is often even after 1 or 2 psilocybin sessions. The next evidence we have is a treatment-resistant depression. It's a little bit more challenging, and yet we still have a lot of positive outcomes. Of course, a lot of times, probably people have heard of end-of-life anxiety. Patients often, terminally ill patients face a lot of fear, a lot of uncertainty, how to go through this process. When they do psilocybin-assisted therapy, one of the things they often say that this has been the most meaningful experience in their lives. Because psilocybin is a property, it can help to increase acceptance, bring some peace, and just bring some form of spirituality. Another area that's becoming getting more attention, and there's research in treatment of post-traumatic stress disorders. I mean, we've heard a lot about it happening with MDMA. Again, psilocybin experiences can be unpredictable, but the research has shown that the patients are able to be in a more regulated place and can access some empathetic feelings and really process their trauma during that time. And there's more and more studies are needed still. Another area, obsessive compulsive disorders, OCD. Now, we're kind of just touching the tip of the iceberg with that. There's very few research still, and maybe in the smaller number of patients. They do show that for a period of time, meaning for anywhere between 2 to 6 weeks, the patients have shown reduction in their OCD symptoms. However, we have yet to see long-term results from that. But just thinking about the critical period, the timing, where a person is going through neuroplasticity, patients, in a conventional treatment right now, right, there is a limitations. A nutraceutical medications can only have like a 30% reduction. Conventional psychotherapy maybe adds another 20, 30%. So during the window, the patients, if they're engaged in a really strong psychotherapy, targeting their symptom reductions and maybe even changing their relationship to their symptoms could really set them well long term. Another area, this is where I see actually a lot of patients are turning to people who've been struggling with addiction disorders. And the way that the strongest evidence we have, so a lot of research studies are now currently on alcohol use disorder and nicotine smoking. And all of the studies were done in conjunction that the patients were also engaged with the therapy, and many of them were receiving some kind of a psychosocial support or maybe engaged in 12 steps. So the psilocybin has a particular way of rewiring drinking memories, working on reward pathways and just creating sort of a connection to spirituality, which is so crucial and important people who struggle with addictions.
Thank you, Inna. And so, yeah, it's definitely really exciting to hear about the different mental health areas where psilocybin therapy could be a promising option. But we also know that it's not a right fit for everyone. And so I'm hoping you can speak a little bit more about what are some of the factors to consider when referring patients to psilocybin therapy, including thoughts about appropriate timing along a client's trajectory of care.
Yes. So, and this is actually the most significant area of interest to me. I mean, it's pretty simple when we have a certain patients who either exactly fits into like some kind of a contraindication criteria. Again, in from what we're hearing in Colorado, it's different than in Oregon, where patients who are clearly maybe do not have a polypharmacy or a severe mental health illness, it's a lot easier to guide them. But many of the patients now are being chronically ill. They have treatment-resistant depression. They also have a lot of polypharmacy. And those are the patients that can still so greatly benefit from psilocybin-assisted therapy if it's done in appropriate way in collaboration between mental health care practitioners and psilocybin centers. So I want to focus a little bit about we have learned, in Oregon, psychosis is one of the mental conditions that history of psychosis or active psychosis, they're not able to receive psilocybin assisted therapy. It might be somewhat different in Oregon. Um, or patients who have like active suicidality. The other population that has not, there's a gray area, and I can speak a little bit more to that, patients who are with substance use disorders. I want to bring, there's a lot of a conversation around medications, okay? There are there are medications that are contraindication. We know that right now with lithium, because there's an increased risk for seizures, there's maybe even acute activation can happen, or even a possibility of serotonin syndrome. There's a lot of category of medications that are, I would call it more of a caution or something to either could be a risk factor or simply they can have a blunting effect. So I want to divide that category into different categories. So there is a class of medications, including antipsychotic medications, mirtazapine, trazodone, and I'll speak a little bit about SSRIs and SNRIs that do act or target 5-HT2 receptors, and they can potentially, again, I want to use the word potentially, can block psilocybin experience. This is the time to revisit, are the patients are appropriate? Is this the right patient to taper off of them? Let's say all of their antipsychotics or mirtazapine or trazodone. I want to share just a little bit about the studies that have been done on SSRIs and SNRIs. I think there's a lot of myth in the gray area with that. And up until this point, a lot of patients and providers under the impression that the patients have to be off of these medications because otherwise the experience might not be meaningful. Contrary, majority of the studies that have come out in the last few years shown that the patients have been able to have a meaningful experiences. The studies were done on patients who were on SSRI medications or were put on SSRI medication. Right now it's Celexa that's most frequently used in all of the studies to compare, and they have not seen significant difference. Now, there were studies that were showing patients who have been tapered off of SSRIs 2 weeks prior to the study. Now, this is an interesting thing. The idea of tapering off to avoid the potentially blocking effect. However, the studies have shown the patients who have tapered off and have not been emotionally stable or in regulated condition, they actually might fare worse than the patient who remained on SSRIs or SNRIs. Now, again, there is a big topic. Have people been on these medications for a number of years? Again, if they were to do psilocybin assisted therapy, this could bring a conversation about perhaps over time creating an ability of tapering process, but the patients do not necessarily need to be off of these medications. If they can be tapered off of the antipsychotics, it's preferred by far. However, if the risk is greater and the need for psilocybin therapy is important, then it's something to consider. There's another category of medications that fall under what's called controlled substances. And I want to talk about 3 different categories. One is actually related, something that's called sleeping medications or hypnagogics, such as Ambien, Lunesta, and benzodiazepine medications, such as lorazepam, Xanax, clonazepam. Although neither of these medications are a contraindication to psilocybin-assisted therapy, they may not even affect in any negative way the experience itself. Some patients might even have a big experience. The challenge is their diagnosis of treatment resistant may have something to do with the fact that they have been on these medications long term. I've been treating addiction for 20 years, and what I've seen over time, even if the patient dose has not increased over the years, they have built the tolerance. They might be already in some state of kind of consistent withdrawal. What that means, if they are on these medications and these medications are causing some of their issues with mental health, and they were to go through psilocybin assisted therapy, there's a possibility that the psilocybin therapy was fabulous. They have gained insights, but at the end of the day, long term, the patient remains in the treatment resistant depression state. So I want to advocate that these medications are being strongly looked at as something that they may potentially need to be converted to a different class of medications or something that's long acting. And I can speak a little bit about it later, but I just wanted to bring that into the focus, okay? That the psilocybin therapy is not going to fail them, but it's actually the medications that are on. Another class of medications, opioid medications. You know, patients have chronic pain. Again, we have a pendulum that's swinging. If in the, previously everybody had to be on opioid medications. Now it's like nobody should be able to prescribe opioid medications. Yet again, we do have that. There are patients who are on medication assisted treatment program, MAT, which means they're receiving either methadone and buprenorphine. What I find, again, if they're on regular opiates, they're not necessarily have to be a contraindication, and they yet can have a big experience. But if they're depressed and they're on Vicodin and OxyContin, again, those are the medications. Actually, the newest thing now that's receiving a lot of sort of information is kratom. I do see that in Oregon a lot. There's a lot of patients showing up to psilocybin centers taking kratom. And there's for some reason they feel that psilocybin might be the way to get them off of it. I do want to bring something important. Psilocybin is not a detox psychedelic. It's really mainly there to support whatever issues or trauma, something that's underlying the patient's addiction. The patients who are on buprenorphine, they are your perfect patients to put them through psilocybin therapy as they're stabilizing their medication. Maybe it's treating their pain, maybe it's addressing their opioid dependence, and they are just the right candidates, and the outcomes are likely to be great. And in general, and just in general, to look at patients' polypharmacy. So I really do feel that bringing psilocybin assisted therapy as a great tool is a way to help people to look at the pharmacology. The other part is some of the patients might be receiving medications throughout the day. So we have to be careful if it's something they need to be doing it throughout the day, because the session lasts for a few hours. So we want to make sure the patients are safe. So that's a little bit on that. I want to talk about just a few physical health. There are some physical conditions that are not necessarily a contraindication, but you want patient to be stable on. This is patients who have a complex cardiovascular condition or hypertension, especially if it's uncontrolled hypertension. We know that psilocybin can raise temporarily heart rate and blood pressure. So it's really important that the patient either stable on their medications, or if there is a concern, that there is a consultation either with primary care or cardiologist. There's one unknown area is patients with a history of seizure disorder. So there is no data right now to show that psilocybin can increase the seizures or decrease the seizures, because we don't really have a lot of studies done on that. Right now, simply the patients who have any history of seizures have been excluded from the studies. So just something for folks to think about. Again, diabetes, if it's type 2 and then type 1, and they have to take insulin just to make sure, that's something that's pretty well balanced. And again, when in doubt, really having consultations and getting permission with a specialist would be really important for patients to go through psilocybin therapy.
Thank you, Inna. Yeah, and I think one thing we always like to emphasize is that, for most people, psilocybin is physiologically a pretty safe compound. However, given the nature of these state-regulated programs and the fact that, broad swaths of the population may be seeking access who do have pre-existing mental health conditions, physical health conditions, maybe elderly, maybe at end of life, there are a whole host of considerations to make sure that each person is really supported to be able to best benefit from the experience and mitigate the likelihood of harm. And so I think that's why it's really important that we do have these conversations about how this care can be best integrated within our existing healthcare and behavioral health systems. With that, I do want to turn to a couple questions for Joshua and Yuriy. So Joshua, given your experience with Fireside Project, managing this team of coaches and offering support pre and post psilocybin experience, how can healthcare providers think about matching a client to a facilitator, and what are the types of questions that clinicians or clients themselves can be asking to determine fit with a facilitator?
It's a really, really good question. I think that the way the foundation of the relationship between a client and a facilitator is trust. And how comfortable does the client feel around the facilitator? How open does the client feel? How vulnerable? And so I think the types of questions that a client may want to ask are similar to those that they would follow when they're hiring a therapist. How do I feel around this person? Do I feel like they get me? And so forth. Also, I think there's, some self-awareness that the client should be cultivating. Are there aspects of my identity that I would like to see in a facilitator? For example, perhaps, as a Jewish person, if I'm going to be taking psychedelics to address religious trauma, it may be important to me to have a facilitator who identifies as Jewish. If I'm a sexual assault survivor, it may be important to identify a facilitator who has experience with that type of process. So I think there's really no shortcut for speaking to multiple facilitators, getting a sense of their experience, getting a sense of their identities, and really checking in with yourself and, most importantly, your body about how safe and how trusting do you feel around this facilitator.
Thank you for that, Joshua. Yeah, and I just think it's so important for people to understand that going into this psychedelic experience, it is an altered state. It's in many ways a very intimate and vulnerable experience. And so I think the importance of that trust and even just intuition about the facilitator is important in a way that doesn't necessarily show up to the same extent in other areas of healthcare, with perhaps the exception of the therapy relationship, but even to a heightened extent.
Yeah, and I think it's really important for, clinicians to frame for their clients that an experience with psychedelics just doesn't have any parallel in Western medicine. We often, Western medicine typically works in a way where we as the patient are a passive actor. We take the aspirin and then the headache goes away. That's not how it works with psychedelics. Psychedelics really require, I think, like a big commitment, a deep preparation, long-term integration. And the more that a client wants to get out of it, the more they have to put into it and the more they have to prepare. And so I think starting to share about that need for like deep engagement and time as early in the process as possible is so critical.
Thank you for that. So I want to make sure we have time to bring Yuriy into the conversation. Yuriy, I really wanted to invite you to this session to share the work that you've been doing on creating this referral pathway and how this can be an example of an innovation that really supports communication across different specializations to support really holistic and integrated care for clients. So I'll hand it to you.
Thanks, Tasha. So yeah, like by nature, psychedelic care is deeply integrative, deeply collaborative, and yet the old systems are not designed for this collaborative care delivered by independent practitioners. So here at Homecoming, we've been really thinking, how can we break these walls between different independent parties who can and want to collaborate together on the same client cases? And so let me do a quick screen share to show what's coming up in the next few weeks in Homecoming in collaboration with Fireside Project. So I'm going to send request for screen sharing.
Yep, I've just made you the host.
So in a yeah, so in a typical kind of medical EHR system nowadays in the Western medicine, like you can see a client list, you can click on it, you can assign practitioners within your team. In this case, I am the practitioner. Like you can't really break the wall and find someone else with whom you can collaborate on this. So instead, what we're now going to make available, and for those healing centers in the room who already are using Homecoming, you will have this coming up in a few weeks. So when you try to assign a practitioner to a client, you can see the current care team, Chris Dixon and Antonella Espinoza, but also we're like showing you the preview of what the referral network for specifically for psychedelic care will look like. In this case, as a practitioner, you could see an option to refer a client to Fireside Project here, or for example, to refer a client who is outside of your scope of practice for screening to Gladstone Psychiatry, who are like excellent in medical screening for psychedelics, and actually their services are also reimbursed by insurance, so it will not bring up the cost of treatment for your care team or for the client. And so when you would click on the refer button, you would be able to share some client background, some reasons for referral, and of course, like if you need to assert that you have already collected the client consent for this referral to be made. And then once you click submit the referral, like the Fireside Project team, their intake person will be added to the care team for Goran's client case, and they'll be able to collaborate with you on this case without being a part of your staff, without being a part of your system, and they'll be just having access to this one client case. So our hope is to create a network, a referral network for this collaborative care to be delivered by this community of vetted, pre-curated collaborators. And if you have a project in mind who you think should be a part of the referral network, please message me and I would love to speak to you. Thank you.
Thank you, Yuriy. So we are getting close to the Q&A portion of the call. There's a few questions already, but I just want to encourage folks, if questions are coming up, please go ahead and place them in the chat. I do have one more question that I want to direct to Joshua before we jump into that, which is, so Fireside Project is a support hotline for people that have had a psychedelic experience or are currently having one that they want to reach out for emotional support, right? And so through offering that service, and it's a free service, I just want everyone on the call to know it's a free hotline available to you, and we'll drop the information and share that out after the call. But what are we learning about the types of challenges that sometimes do emerge after a psilocybin experience, and what kind of supports can be helpful for clients that are struggling after an experience?
Yeah, that's a great question. And first, I just want to say, if you'd like, we can mail your service center stickers. We can mail you flyers to put up or to share with your clients about how to access our services. And they can really be, I think, like powerful when your service center closes for the evening or on the weekends, and you want clients to be able to have a free resource. But I think for what we see on the support line, and we've had about 30,000 conversations in the last 4 years, 60% of which involves psilocybin, not because it has a higher risk profile, but because it's just the most commonly available. I think the first issue we see is like lack of preparation. When someone has, especially a high dose psilocybin experience, and they haven't prepared themselves, they may not be attuned to their emotional world. They weren't prepared for the fact that there could be some destabilization that happens, that there are assumptions about their worldview and their place in it can be upset. And so that can be a very, very challenging place to be. So number one is the more people prepare, the better off that they are. Another issue that people encounter is I think like challenges communicating with loved ones in their life about the intensity of the experience. It can be really challenging for the loved one of someone who is going through an experience. They fear that their partner may be changing, or the person who's journeying fears how to communicate with their partner, how to share the enormity of what occurred. So that's another thing. Additionally, there are many people who reach out to us who they either know that their therapist or clinician is not supportive of psychedelic experiences, or, and this is important, or they don't know whether their therapist is psychedelic friendly. And if a client doesn't know whether it's comfortable, whether it's safe to talk to a clinician about their experience, then they probably won't do it. And so I think that can create, I think it can be important for clinicians who are familiar with psychedelics, whether they've taken them themselves or at least they're very familiar with the literature, to make that known in different ways, so as not to so as to build trust and so as to ensure that the client doesn't feel like pathologized or guilty or ashamed for having made this choice.
Thank you, Josh. I really appreciate that. And I do want to just note in Colorado's state-regulated psilocybin program that there is actually a requirement that if somebody is seeking access to psilocybin to treat a diagnosed medical or mental health condition, first of all, that they either work with a clinical facilitator for whom that condition is within their scope of practice, or they complete a consultation and risk review with an appropriately licensed provider. So those are two requirements. But there's an additional requirement, which is actually that the clinical facilitator then contact the treating provider for that client or patient, essentially to notify them of this person moving forward with psilocybin therapy, unless there is good cause for them not to contact that treating provider. So an example of good cause could be if it's a provider within the VA system and there's concerns on the client side about alerting somebody within the VA system that they're using, a federally illegal substance. So there's cases when that does not apply. But the goal there is really to support communication. So somebody's not going in accessing psilocybin, going back to their therapist or treating provider, and that person has no context for what, this really monumentally impactful experience that they may have just gone through and the types of things that are coming up. So our hope is that by including that, we're really fostering this dialogue to take place and getting ahead of that type of situation where they're, trying to hide something about their journey. But there's complications there. And so I think that's part of why these types of educational endeavors are really important, because it can be harmful to somebody who's really struggling to feel like they're not supported in exploring something that might be beneficial for them or might seem like an option that could work better than whatever else is available to them, to even, not be able to have open and honest conversations to understand the potential benefits and risks around it. So I am going to move over to some of the questions we're receiving in the Q&A. And again, if you have questions that have come up, please go ahead and put them in here. So there's a question: is it possible for further development of regulations regarding places of psychedelic sessions? As we already know, the surroundings or settings affect clients a lot during the session. I am feeling like this one might be good for me to address because I'm sort of the policy nerd on the call when it comes to the state programs. So I just want to clarify that while most of these sessions will take place at licensed locations, there is actually a lot of flexibility for what those places look and feel like. And this is directly responsive to the fact that the setting of these experiences does appear to matter a lot. And so when we talk about psilocybin therapy, a couple of terms that come up are set and setting. Set being sort of the person's internal context in which they're going in, what are their intentions, what kind of care have they received leading up to it, components like that. And then the setting: what is the physical environment, who's present, does the person feel safe? And so when it comes to setting, a lot of these healing centers or service centers are set up in a way that there's soft lighting, there's art, there are plants, they're really making an effort to create a space that feels comfortable and cozy in many cases. There is also the option for these sessions to occur outdoors, which is really interesting. Now that needs to be designated to the state, when they're going through their licensing process, that there is an outdoor administration area and there's safety requirements. They still need to have access to an indoor space. Thinking about if a storm rolls through, you're probably gonna not want to just be out in the wild. But having access to a safe indoor space and then a space free from hazards. But really, there is a lot of flexibility built in to try to create an environment that is conducive to this healing experience. But there's always the possibility, as we learn more, to continue changing the rules around this program, to continue adding options. And that's part of why we're really focused on also starting to gather de-identified data about the services that are offered and also the outcomes, so that we can better understand how some of these different factors relate to each other. All right, I'm looking here at another question. So we have a question for Inna. Any guess or conversation suzetrigine, Jornak's impact precautions in conjunction with psilocybin? That is way above my pay grade, so I will let you speak to that.
I can make a comment on that. It's actually something new that's came down in the pipeline as we're searching for non-opioid ways to deal with chronic pain. I just will just say something about its pharmacology. It kind of falls along the line of some of the anticonvulsant medications. It goes through what's called sodium channels, which are very similar to lamotrigine, trileptal, potential lithium. There's no studies right now to show that there's any contraindication or any issues with that. So, lithium right now is the only medication in the class that is a contraindication. So I'd say right now it's pretty safe unless we know something different.
Thanks, Inna. Yeah, and that's one interesting thing about psilocybin, my understanding, is that it doesn't seem to be contraindicated with a whole bunch of substances based on the data that we currently have, which is a positive, of course. Okay, one last question here, and then we're going to have to wrap. Can you speak to the licensing agreements / compacts between states, i.e. a psilocybin licensed provider in Colorado is also licensed in New York? Can that Colorado provider offer services that are legal in Colorado but not in New York? So this is one where, I wish that we had our 3 lawyers from yesterday on the call. What I would say is that, if you're licensed in New York and you're practicing in Colorado, physically in Colorado, the client's in Colorado, you have your licensed facilitator license in Colorado, that's legal. That's what this program is set up to allow. I think in terms of the specifics of how that, relates to your practice in New York and the specific clients that you're working with, for instance, is the client from New York traveling to Colorado to work with you in your Colorado practice, there may be legal considerations there. So that's the type of instance where I would definitely seek legal counsel as you're setting up your practice, just to make sure that you're considering all the different implications. And then also we will share out the webinar from yesterday's call focused on dual licensure, which gets a lot more into some of those considerations around dually licensed clinicians who are also facilitators in the Colorado program. All right, well, that is unfortunately all we have time for today. And so I apologize to the questions that we did not get to in the chat. But we definitely encourage you to check out the continuing education and CME resource directory and consider what additional education that you can seek out to help support you to deepen your preparedness to consult with clients on this topic. So thank you so much, Inna and Yuriy. And I know Joshua already had to jump off, but just really appreciate you joining for the call.
Okay, thank you. Take care.
Thanks, everybody.